Yep. Awesome. We are live. Hey, thanks for joining us today here on your Thursday, and I'm really excited today to talk with somebody I've known for about a year or two now
Yeah.
through just conferences and getting introduced to people in the healthcare and health insurance space, and has overlap in those areas. And our guest today, David, definitely has some overlap, particularly with providers and with guiding people to the highest quality care. So I'm really excited to talk with David today from HealthMe, and we're going to learn a little bit more about how the nuts and bolts of what I sell and what other people do in on my side of the industry is selling access to higher quality care, eliminating employees' deductibles and copays and out-of-pocket expenses. But where exactly does that fit in? How exactly are we able to connect people, your average everyday user who doesn't even know what a deductible means or what coinsurance is? How do we connect somebody that has such a low knowledge level about how their plan operates to those high quality providers that are in their area? And that's something that HealthMe does a really, really good job of, is guiding people to those higher quality doctors through their software and through their process and through their partnerships that they have with providers' offices across the country at this point. So David Comiskey, if you would please introduce yourself, sir, and tell us a little bit about yourself, and then tell us about how you came to start working with the folks over at HealthMe.
Yeah, sure. Thanks, Chris. Really happy to be here. Great tee up, I think, in terms of talking about all the challenges that members of the plans that you're working with have in terms of identifying and finding high quality providers in their community that are going to be, low or no cost to the member and low cost to the plan as well. So I'm Dave Comiskey. I'm the Chief Operating Officer at HealthMe. For those of you who are tuning in live or going to watch after the fact, HealthMe is a national network of transparently priced bundled healthcare. We're a physician-founded company, so our CEO is an orthopedic surgeon and started HealthMe a number of years ago. I've been with the company for 5 years now as the Chief Operating Officer. Have been a technology entrepreneur for a number of years, have enjoyed building and solving a variety of solutions to solve different problems in different industries. HealthMe is my first foray into healthcare. I like to sort of say that I'm 5 years new to healthcare because I swear every single day I'm learning something totally new. And in this complicated, messy world of employer benefits and all of the nuances on that side, and then working with healthcare providers and all of their nuances. Really, what HealthMe tries to do is bridge the gap and provide common language between the providers and just bringing more providers into this direct care model to work with folks like yourself, Chris, and plans that you're representing. Prior to HealthMe, my sort of the problems that I solved were in pet care, very different industry, and we're in national security with the Defense Department, also very different industry. I will tell you, healthcare is more complicated than both of those things, and this has been a big challenge that we've been working on, and I'm happy to talk about it today in terms of what it is exactly that we do.
Yeah, well, that'd be great. Let's just follow that thread. You mentioned made a comment about bridging the gap, and again, I think that's a lot of times what we see is the most important part of health plans is not necessarily even the fact that you're self-funded or level funded, or you've got these very cool cost containment solutions and medical management, and all these bells and whistles are great. But ultimately, it's that communication, and it is bridging that gap with the end user, with the employee, who are the ones that ultimately need to get in and get care. And in many cases, it may be somebody who's getting care for the first time or doesn't have a lot of experience with needing to get in and get care. My granddad used to joke about the hospitals are where all the sick people go. Why would I want to be there, right?
Right.
And anyway, so if you don't have that experience of having worked extensively with doctors, or you don't have if you just don't have that experience, then how do you bridge that gap? So yeah, let's follow that thread here for a minute. And yeah, what does HealthMe do to help support employees on their healthcare journey?
Yeah. Okay. So first off, I totally agree with your granddad. Hospitals are for sick people, and do a great job caring for sick people. But a lot of patients who need healthcare services, particularly the ones that HealthMe works with them on, elective outpatient orthopedic surgeries or other elective surgeries, like that can be outpatient. You're not sick necessarily, you just need a high quality provider. And so we'll get onto that topic, I'm sure, at some point here today. But really, if you're going to bridge the gap, what's most important is having effective care navigation as part of your plan. These care navigators, and HealthMe works with a lot of them across the country. Those care navigators are working with plan members to provide an alternative path for care where the member may go to just any generic healthcare provider, but if they follow a path of navigation, their out-of-pocket expenses are going to be waived, and it's going to go through a direct contract. One of the problems that care navigation companies have, not so much on the engagement side around the members and getting members to engage their services, but it's actually knowing which providers to send members to when they get that engagement. And so the care navigation firms that HealthMe is working with, they're constantly looking in markets where they have employees, covered lives, and patients that they're working with, trying to figure out, well, if I have an orthopedic service, where should I send that patient? Or if I have a member who needs a general surgery, do I have a general surgeon in the market who I can direct contract with? And how am I going to find and manage all of these relationships? When HealthMe entered this space, it was a benefit advisor that we were talking to. We had built a really large network of orthopedic providers specifically. And those orthopedic providers had done what our CEO did when he first started the business. They had worked with HealthMe to bundle and price everything that they did. They had transparently priced office visit bundles that included a visit with a doc and an x-ray if needed. They had transparently priced imaging, physical therapy, in-office procedures, and transparently priced bundled surgeries as well. That included the facility fee, the implant, the anesthesia, the professional fee, everything. All of that was available. And today it's about 2,500 orthopedic surgeons that are using HealthMe as their sort of direct care and price transparency partner. This benefit advisor told us, well, if you're going to solve the problem of the care navigator, you need to make it easy for them to, one, do what they do, and that's redirect members to providers like the groups that you're working with HealthMe. And so they need to discover the services, but they also need to confidently, be able to refer patients into those groups, knowing that the groups are going to handle and care for that patient effectively, and know how to direct contract and be in communication and do all of these things. So what HealthMe really does, beyond just providing a referral management solution, is I think we deliver those care navigation firms a network of providers who, one, know how to conduct this type of business, an alternative payment model outside of the fee-for-service world, and two, are fully transparent about those services and how they're doing it. Right? Transparency is ultimately the foundation to this on the provider side, and that's what the employers are looking for as well. They want predictable costs for their healthcare benefits, and that's what we're ultimately trying to provide at HealthMe.
Yeah, no, that's excellent, and I appreciate you sharing some of the background with your founder and CEO, as his background as an orthopedist, and I'd be curious to learn more about kind of what he's seen, or maybe what you guys have seen as you've kind of tried to bring this this new approach, right? And and I think about this from my perspective of doing the same thing on the health insurance side of hey, this is a different way of doing it, right? We see this is the problem that's been created. We've been coached, we've been conditioned, and I imagine it's on the provider side too. That gee, there's nothing we can do to change the cost of healthcare. There's nothing we can do to have an effect on this problem. And I think the problem that the employers have been presented over the years and frankly decades at this point is that there's nothing they can do to control this health insurance cost, right? Well, health insurance is expensive because health care is expensive, and it's one follows the other. It's this chicken and egg, right? But at the same time, there's there if we present the problem differently, we can present potentially different solutions as well. And so I think that's part of what you're talking about there. Expand on that.
Totally. Totally. I think, you know, we are both you on your side with your clients and HealthMe with the clients we have, particularly on the provider side. It is a new way of doing business. It's a new way of thinking about the way that healthcare is bought, sold, and paid for, right? And that does create some brain break at first, is the way I like to call it, right? Because it's just so different from the fee for service model that has sort of been the status quo for so very long. And there are a lot of misconceptions around this direct care model on both sides of the table. I think the provider and the employer side. On the provider side, some of those misconceptions are that at least for the independent sort of groups that we're working with, they think that this is a potential model where they have to heavily discount their services to be able to, deliver savings to employers who are looking to direct contract. And that really couldn't be further from the truth. Yes, employers are saving money through direct contracting, but no, they're not doing it by paying the professionals, the physicians, any less than really what those physicians would be getting, and potentially even more than they would be getting through contracted rates with the large carriers. Where employers are saving money is by shifting through direct contracts the venue of care. And so every HealthMe client today is a private practice, independent group that often owns or has co-ownership in outpatient ambulatory surgery settings. And when they're building bundles, they're building bundles that include all parties of that bundle. And the professional is getting reimbursed extremely well, as are all parties of the bundle. Why are employers saving money? It's because these elective services aren't happening in venues of care that are more expensive than they really need to be for these services. And we see it all the time when we're looking at claims analysis. And we look at a lot of employer claims at this point, right? And it almost is so simple. Last week I was looking at 88,000 rows of claims from a 3-year history for a self-funded employer. And I looked at all of their spend, and I was just like, all right, I'm just going to filter by this one CPT code in orthopedics that I know I'm going to find savings. And like instantly in the last year's time, I found half a dozen cases where the employer overpaid by like literally 4 times as much as they should have had they gone through HealthMe for like a total knee replacement or something like that. And it's just like those providers are getting paid great through a bundle. The employer is saving money by shifting the venue of care. And it's actually a triple win, right? Because the patient's also having no out-of-pocket expenses. So this brain break comes from like, how is that possible? How can every stakeholder in this equation actually win? But that's the model that we're pushing, and that's working in every sort of corner of the country at this point, with self-funded employers and the providers that we have the opportunity to be working with everywhere.
Yeah. Oh, absolutely. Yeah, and we've seen that too. I mean, just a recent example of that was we had a lady that needed to go in and get a carpal tunnel release, right? Like just a really basic surgery. And Medicare reimburses, I think it was like $5,800 or something like that for
Yep.
this same, and yet at the same time, the the facility, the hospital where she, unfortunately, she was one that was originally had been referred into a hospital setting for this procedure. They wanted to charge $60,000, right? They wanted to charge more than 10 times Medicare, and and tried to get us to sign a single case agreement that was, not a single case agreement, that was an agreement for anything done at that facility for the next 12 months after that event was going to take place. So luckily in her case, we were able to get that rerouted. But yeah, you just think about, it's like, well, if you're, it's like to your point about, geez, are these doctors really going to take direct contracts? And it's like, geez, even if we paid, let's say would have paid them $12,000, which would have been twice Medicare. At that point, they're still making a nice, they're still making a good amount of money or what have you. But to charge 10 times more than Medicare just seems totally egregious. And I think anybody would say, geez, that's beyond the scope. That's totally unnecessary. But unfortunately, that's something that we see those kinds of instances so often. And and that's, again, it's a lot of times it's hard to believe because most people think, well, geez, if for any other transaction, if I pay more, I'm going to get something of higher quality. And in healthcare, a lot of times it's the opposite. And that's the other thing I failed to mention was this facility for carpal tunnel releases. As we started to look into it, the doctor she was going to go to was not highly rated. Right, this was a guy who's got a lot of revision surgeries. So can you imagine having a carpal tunnel release? Total cost of that being $60,000 and then having to go back in because of a mistake or an infection or, who knows what, right? But, whereas we know outside of the hospital setting at those outpatient surgery centers that they're going to get better quality care. They're going to get their issue addressed. And a lot of times too, these bundles you're talking about, they've got some of those contingencies kind of baked into that too. So if this happens, right, we get in there, carpal tunnel's maybe a bad example, but some other kind of surgery, if we get in there and find this complication or this problem, they've already solved for that, right? They already have an idea of, look, this isn't going to cost you more. This isn't going to, you're not going to feel as though you're nickeled and dimed when we've got you open on the operating table, right?
Right.
And so, so it's kind of interesting to see how that shift in people's perceptions. And that's where I think a tool like HealthMe is great. And where, any medical management vendor is great because they're able to help kind of make this simple for the patient, for the end user, to the point that they can feel confident that they're getting the best quality care. And if they're working with us or others that are building plans the way we are, then they're also getting that care at no out-of-pocket cost. I mean, it's that you said it. There's a triple win. It's the win-win-win. It's the Michael Scott. I win, you win, and everybody wins, right? So, it's completely possible.
Well, I'll just say a few things on that. First off, that is the most expensive carpal tunnel I've ever heard of. My mind is blown right now, and I'm not going to. But if I screen shared right now, I could say on HealthMe, hey, let's show Chris carpal tunnel surgeries across the entire country, and you're going to find them for probably on average $3,000 to $5,000 on HealthMe in every community, in every town across the country, like plus or minus a few $100s probably. And it's another one of those surgeries where I'm sure the orthopedic providers or folks who work in the orthopedic setting are listening in, or like that's going to in-office. You don't even need an OR to do that kind of surgery in many cases anymore. And that's driving costs even further down, right? And so, those numbers are mind-blowing. But every time you look into a claims file for an employer, you're finding those numbers where it's just like, jaw-dropping and sort of sad, really, right?
Yeah.
And you're right. The quality is probably often better outpatient. It's certainly no worse than in a hospital setting, right? And the savings are just astonishing. A lot of the times, too, you will find that it could even be the same doctor, right? You're just shifting that venue of care out of a hospital and facility to a outpatient And that alone is great. So what you want to be able to do though is have the right member engagement strategy on the front end, where before that member even enters into any sort of care pathway, they're engaging with the navigator or a patient advocate saying, hey, I'd like to understand what my benefit is, and get your recommendations on where I should go and who I should see for this, so that I don't end up in the wrong facility, or in the sort of with an out of pocket expense that I don't want to have to incur. And that's where I find the power of navigation to be most compelling, right? Where if you form the right relationship with your members on the front end, if there's the right advocacy, if there's the right education and engagement, like, your member is going to know, oh, let me call my care navigation team and let them know that my hand's been bothering them and that I've seen my primary care provider and they're recommending I go see an orthopedic professional. Let me do that before I just go see any orthopedic professional, so that
Yeah.
it all starts right from the very beginning. Because once that patient forms a relationship with their doctor, right, it becomes much more challenging to redirect them. Well, I really like Dr. Jones and kind of want to stay with him. And if he's going to do it at the hospital, whatever, I'll just pay that cost. Like, that's that pitch to say, well, don't you still want to see Dr. XYZ as an alternative? That becomes much harder than just sort of having that front end engagement. And when we work with navigation companies, that's often something that we're looking to understand how they're doing it. How are you getting proactive outreach from members versus always being reactive? I think it's a huge challenge, but it's sort of the ideal state if you have it in a more proactive way like that.
Yeah, I would agree 100%. It's always kind of hard to unring that bell, so to speak.
That's very
We've certainly
good, right?
found that as well too over the years with, somebody who's entrenched with their provider already. Sometimes, and that's where again the plan design thing is that can be huge, because
Yeah.
what we end up saying is it's like, all right, well, if you want to see Dr. Jones still, that's totally fine. Assuming that Dr. Jones is a low quality doctor or is at one of these lower quality facilities. But hey, look, you can do that. That's your prerogative. This is your plan. It's your, you can totally do that. But if we'll source other higher quality doctors, and if you end up following our recommendation, that's where we can eliminate your deductible, your copays, your coinsurance. Any costs that you have associated with this are going to be wiped away if you go this direction. And so then it becomes a lot easier decision for them to say, okay, wait a minute. So if I'm gonna go to I'm gonna go to a higher quality facility. I'm gonna go to a doctor who's more proficient and effective at providing this service. And I'm not going to have to pay anything for it. This, it's like the hurdle we come into at that point is like, this sounds too good to be true. This,
Yeah. Where's the
what's
catch?
the rub? What's the catch? And it's like,
Yeah.
it isn't. We're putting you first. We're putting you as the patient, as the employee, in the back in the driver's seat, and as the primary, as the primary beneficiary of this, compared to how this has been done in the past, right? Where it's like, otherwise, oh, just make sure they're in network, right? That's the main thing. Just make sure they're in network, and it's like, yeah, that just doesn't cut it, because this, and I think probably most of my audience does as well, but it's worth repeating, is that if you were to call, Aetna, Cigna, United Healthcare, whoever, and say, if that's your the insurance carrier that you have, and say, hey, I just want to make sure this doctor's in network, and then so on and so forth, and then if you said, hey, I want to know who the highest quality doctors are that are in network. The answer you'd get on the other end would be, well, we can't tell you that because of our network contracts are not disclosed, and we need to spread that patient profile evenly across all of these providers that are in network at this certain facility or this certain hospital. And so it's you may be going to a doctor who's in network, but they contractually and legally can't tell you who the higher quality performing doctors are, it's kind of like, all right, well, what's so great about the network contract then? Just that
Right.
it's, and that whole narrative kind of falls flat at that point. Whereas if you could understand, hey, look, we've got an open network, or look, if it is a situation where you do have a network for whatever reason, then having that healthcare navigation team and having the tools behind the scenes to be able to guide and direct you to the highest quality providers, the highest quality facilities, isn't that much more valuable of a plan and of a benefit? I mean, I think you'd be hard
Totally.
pressed to argue that point, right?
Totally. And I won't forget this. I had a navigator as we were sort of first talking to and working with navigation companies. I was getting super, I'll say, anxious, where I was like, gosh, I have to, they just signed, a big group in this community, and I've got to get all these different providers in that community up and going, and get their bundles built and all of this. And the navigator's like, no, Dave, we don't need everyone. I just need one. I need one of each of the core specialties that are going to drive high cost claims for the employer. So I need an orthopedist, I need a general surgeon, I need a gynecologist, right? Like, if you can get me that, that's all I need. I don't need everyone. I just need one. And I started thinking about it. It's like, yeah, network doesn't matter, because
Right.
these navigators are going to, and I see it play out in communities all over the place. They land a good, they land an employer client. That employer client has a concentration of lives in a certain geography. Then they form a direct contract, or they use a tool like HealthMe to form that direct contract. And even if there are a plethora of options, they've chosen their preferred provider. And if you deliver a great patient experience and you're easy to communicate with, even if you're somewhat more expensive than the group down the road on a bundle price, they're just going to keep sending the business to you, because they know that member experience is going to be off the charts with you versus anywhere else. And so,
Yeah.
I think that these navigation firms, in a good way, this is a good thing, play favorites, right? Like, oh, it's wherever, it's Naples, Florida, where I live. We know exactly the doc that we're going to send any member to whenever they need orthopedic care. And it just sort of recycles. And that's why this direct care business is so good for providers to get into. And what we sort of advocate at HealthMe is get into it early. This is still a small and growing market. It's relatively nascent, right? Catch the wave now, and you're going to be, sort of, you'll have the greatest wave of your life, right? This will be a great surf. But, don't wait until it's too late, because if you're the last one in your community coming on, that you have catching up to do versus just being the first that's ready. And so that's a drum we beat a lot at HealthMe. Yeah. Yeah.
Yep.
Yeah. The late fees. Yeah. Yeah. Yep. Yep. That's right. Hamster wheel. Yeah. 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 Yeah, I think, I mean, I'm glad that you brought up direct primary care because from where we sit at HealthMe and HealthMe, we really work with specialists first and foremost, right? But we often point to the DPCs and say like those guys and gals have figured it out well before their specialist counterparts have, in terms of the power of this direct care model, right? And those plans, when we get to work with plans that have DPC embedded, we find that everything else that follows that primary care visit just functions way better and is way more streamlined because the members have that relationship and engagement with their direct primary care provider when the DPC is saying, yeah, you know what, we need to escalate your care. You need to get in with a specialist, an orthopedic or whatever. Like almost the DPC is functioning as the navigator there, right? And certainly as the patient advocate. And so when they're saying, let's get you into the hands of a specialist and make sure that it's a specialist that your plan is, has direct contracts or eligible direct contracts with, everything just functions better. And the ecosystem for the primary care docs, like that loop gets closed with them all the time. So it's like, yes, I referred patient. What happens in a non-DPC model? Primary care refers patient to a specialist and they don't hear anything back. That's the end of the story. It's like, I hope they got into the specialist, but maybe it was 6 months later, and I hope they got the care that they needed, but you don't find out again until the next time you have that primary care visit, the next year or whatever with that member. DPC, the loop gets closed immediately. And so that I think just generally is going to improve patient outcomes and certainly improve the care cycle for them in terms of a full circle loop. So, uh, me either. Yes. Yep. Yep. Yeah. The tip of the spear is the way I say it, right? They're like they really are, and everything does seem to just function better. And it's just for an employer and for a self-funded plan. Honestly, it's a triple threat. If you have DPC in and you have effective patient advocacy and care navigation, and then a powerful direct contracting solution on the back end for specialty care for your high cost specialties, oncology, MSK, gynecology, general surgery, all the high ticket sort of specialties. It, it's like I said, it's a triple threat. The savings are going to be pretty staggering when that all functions really well together. I think both on a preventative and a sort of reactive sort of approach. Every time. Yeah. 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 You, you hit on something that I think is important to talk about as well for self-funded plans when they're thinking about MSK solutions and what an MSK solution should look like that's going to help the plan curb their costs within that specialty and how to handle that, right? And what you hit on was sort of hinting at surgical avoidance, right? And through potentially physical therapy or potentially a specialty injection or whatever. And I think when I talk to employers, there's a lot of interest in all of those things. Hinge and Sword have obviously made big splashes with their virtual physical therapy solutions, and there's other great players in the space as well. And then you have your Regenex and other firms that are sort of working directly with employers to offer surgical, non-surgical solutions. And I just want to say that for the specialists that are listening in, particularly the orthopedics, right, this is an opportunity to not feel threatened by these surgical avoidance solutions, but actually to better position yourself as a total MSK solution for employers that you want to direct contract with or work with. Because guess what? As an orthopedic group, you could do physical therapy solutions that could be brick and mortar, could be virtual, could be either, right? And that's still you all as the orthopedic group doing that, right? Versus a hinge or whatever. And guess what else? As an orthopedic group, you're doing viscosupplementation, you're doing PRP injections and all of these things. And so when I talk to employers, it's like, oh yeah, no, HealthMe's providers, we're doing it all. It's a total MSK cost containment solution. It's an office visit first, and then the doctor is going to determine what's the best treatment plan for that patient. Our CEO says it best, and it's best to come from him, I will say, because he is an orthopedic surgeon. But his opinion is orthopedic surgeons have done themselves a disservice by calling themselves surgeons, right? What they actually are the primary care docs of the musculoskeletal system, right? And if you think about it that way, that's much more value oriented and important in this direct care model when you're talking to employers. Like, we're not just surgeons. Yes, if surgery is needed to be done, we're great at it, but we do all these additional things. When HealthMe looks at like what an orthopedic group transacts on HealthMe, more than 90% of the services they transact are non-surgical, meaning that for every 10 patients that an orthopedic group sees through HealthMe, 9 of 10 of those patients are walking out of the orthopedic group cured non-surgically, right? And like, yeah, exactly. So people think bundles, they think surgeries, but when you're doing this value-based direct care model, it really is the entire spectrum of care, I think. Right. Yep. Right. Yeah. Sure. Yep. Totally. Right. Yeah. Yeah, that's true. We have expanded beyond just orthopedics, and we've it's come that expansion's come really on the heels of our work with employers and advisors like yourself, where we start to look at claims files and an employer spend, and it's like, okay, well, yeah, orthopedics is certainly a high spend specialty, but there are others too where if it's not a bundle, if it's through the traditional fee for service, if it's the wrong site of care, the costs are much higher than they should be, and where that has become a focus for us is one, general surgery. So shout out to Mickey Reinhorn of Boston Hernia and the founder of Hernia Connect, where he saw what was being done by like the Ortho Forum and other orthopedic groups, and was like, well, this needs to happen for general surgery. And oh, by the way, me and 60 other general surgeons across the country have 10 years of like the most robust quality data that you can imagine, and we should be doing this for hernias, for gallbladders, and for things like that. The problem with general surgery is that there's just not a lot of private practitioners anymore. Like they're all hospital employed, and that's why I think he's taking a. There's a lot of urgency to the approach that he's taking there, because this does present a really solid model for physicians who want to remain private and independent and sort of not employed. This direct care business could be the thing that pushes you over the edge to be able to remain independent. And that to me, like, you, when you think about private practice medicine, independent practice medicine, like that's the backbone of our healthcare economy, really. It's the local independent docs in every community, particularly rural communities and things like that. Like it is the independent private practitioners who are holding up our healthcare system, like supporting it, like actually. But yeah, so general surgery, women's health is a huge one. But we're even seeing ENT procedures that can definitely be bundled and approached. Like there pretty much is no specialty exempt from finding value and delivering value in this direct care model. And so it's a big, tall order for us to go tackle all of those at once. But what we've done with orthopedics, we know we can do in other specialties, and we intend to. And it's great because when we can go to a group like a women's health gynecological group in a community and say, hey, by the way, we're already working with your counterparts on the MSK side of things. Look at the success they've had. Would you like to do this together? And that's where I think this sort of community-led, community health plan sort of opportunity really starts to form, particularly, when driven by the independent private practitioners in the community as well. Yes. Yep. Definitely. Yeah. Yeah. Yep. No question about it. Really, really well said. Yeah. No, no, I don't think. I mean, I think we've covered a lot, Chris, and it's been a really fun conversation. If anything, I'll just sort of summarize because I'm assuming that your audience tends to probably straddle providers and employers, and I think ultimately all this comes down to is if you're a provider, bundle and price your services because that's step one to getting into this kind of business. And if you're an employer, like care navigation and direct contracts are going to save you and your plan and your patients, your members, money, right? And it's just like it really can be that simple. We have way overcomplicated the business of healthcare, I think, and um, all that HealthMe is trying to do is bring it back and simplify it for the key stakeholders who in the model today in the fee for service model are getting left behind. And those key stakeholders are the providers of healthcare, the recipients of healthcare, and those who pay for healthcare, right? Like somehow the three most important stakeholders have been left behind and overlooked and neglected in today's fee for service model. So we're just trying to bring things back to the basics at HealthMe. Yeah. Yeah. That's right. Well said. So thanks, Chris.